Good afternoon. Good afternoon, sir. Good afternoon to you all. Today we will discuss a very interesting topic, that is time to stand up for transgenders. So first of all, I would like to share something that, as we all know, Supreme Court in its landmark Nalsa judgment recognized various civil and political rights of transgender community. But still, the transgender community in India are an ignored segments of our society and faces deep discrimination. The expression of sex is not just limited to biological sex of male or female, but intended to include people who consider themselves to be a male or female, or neither male nor female. So generally the thing is, when a child is born, doctor usually says that the child is either male or female based on their external features. So my question is, how does it mean to be a transgender?
So that's a very nice question. I think that the concept of the transgender is not very much clear to most of the common people of this country. And as we can see, transgender is often taken as a very broad term. And the people, those who are transgender, they actually only a small group in the broad term of transgender. So nowadays, this broad terminology has been changed. We now call them queer group. So queer means any person who is not normal male or normal female. And actually, we define the normal male or normal female means that they have the external genitalia of a male, they have identity as a male, they have attraction towards the opposite sex, and they dress like a male. So there are three important aspects by which someone expresses his or her gender. One is basically a God-gifted, that is your external feature, which you are talking about. And second is how the person feel about himself or herself, that is the identity. Third, what is the attraction? Most of the time, the attraction is towards the opposite sex. And fourth, how we are expressing ourselves, and that means the gender expression. Now, these four are basically remains in with synchrony with each other, and then we define as a male or we define as a female. But the issue is anybody who is not in harmony with all these four aspects is considered under the heading of the queer group. Now, the queer group is basically the broad term under which transgender is one. But some of the people, as I have told you, used to call all these people as transgender. It is not that everybody is transgender. Transgender means that those who have an identity is different. So means their external feature, if someone has got an external feature of male and their identity, that means they feel that they are basically female or trapped in a male body or in a wrong body. And then they have an attraction towards the opposite sex, means as because he is thinking himself as female, so he will have the attraction towards male and will express himself as a female by wearing a female dress. So they are the transgender. But not only we have transgender in this world or in our community, we also have lesbian, those who are complete girl, but the attraction is towards another girl. We have gay, the complete male, but attraction towards another man. And we have bisexual, those who have an attraction towards both sexes. So all this together we call LGBT community. L, lesbian, B, bisexual, L, G for gay, and T is transgender. So all together we call queer group. In the queer group, transgender is one.
Well, thank you, sir. My next question is, actually, some people may spend years after years feeling like that they don't fit in this world. So they may try to avoid thinking or talking about their gender out of fear or shame or confusion and take time to realize that they are actually transgender. So, how does someone know that he or she is a transgender? Is there any specific characteristics or way to identify them?
Now, this is basically a self-realization in most of the situation. We actually, as a physician, as an endocrinologist, just by looking into a subject, we cannot diagnose that somebody is basically a transgender.
Okay.
It is the inner identity, his inner or her inner voice, inner feeling, that will tell whether he is trapped in a wrong body or not. Or sometimes, in case of the children, you can say that their behavioral pattern may match to that of the opposite sex. Say, for example, a girl is actually uh, working or playing with the male objects or male toys, male love to wear the male dress, or on the other hand, say a boy, he loves to have the toys of girl choice or love to wear the girl dress. So the parents actually remain ignorant to some extent. Sometimes if they do not have any male child, and as because you know that the male child is always thought to be or considered to be superior to have a girl child. So if a girl wear the male dress, takes up the male toys, then they feel that this is good and they actually encourage that one. The reverse is not true. If a boy behaves like a girl or wear the girl dress or try or play with the girl toys of girls, then the parents become annoyed. So but let me tell you that those who are viewing this program, they should not labor under this misconception that all the boys or girls at a young age, if they behave in an opposite fashion, means that they will ultimately turn up into transgender. No. Majority of the situation is that they actually become normal male, normal female. It is just a variation in the interest, a premature variation in interest, which dies down on its own over a period of time. But the issue is that is basically as a first symptom that may persist in the adult life. So we do not know that which child will become transgender in future and which child will not become transgender in future, despite the fact they have similar kind of behavior.
Okay, thank you, sir. Next, my question is, some trans people, most of the trans people are men or female. Some people don't identify with any gender. It fluctuates over time. They identify as neither a male nor a female, nor as a combination of male or female. So, are they considered as transgender?
No, as I have told you that the transgender has got a definite diagnostic criteria or points.
Yes.
So it depends on of your identity. That's it. Now, someone may have different attraction. You can see a male person can have attraction towards both male and female. That may be romantic, that may be a sexual attraction, and then we call them bigender. On the bisexual. And again, a female can have the attraction towards both male and both female. We call them bisexual. Again, bisexual female, bisexual male. Now, someone may not have any attraction to anybody. So neither male nor female. I don't have any attraction. So if I don't have any attraction, we call them asexual. So asexual is another variety that is not considered under the heading of LGBT, but it is outside the LGBT community.
Okay.
But definitely under the heading of the broad classification, that is the queer group. So that is asexual. But as you have said, that some people in the same life can behave or can feel that they are male. In another point of time, in the same life, can behave as a male. So in the same life, the identity sexual identity, gender identity, varies in the same life, and we call them bigender. Not very common. I am yet to see a bigender person, very rare. We know that this can exist, but the issue is all these together we call under the heading of queer. So it means that the transgender doesn't mean everybody is same. Not all. No, transgender is a different diagnosis. Bigender is different. The bisexual is different, and you asexual is different. So they are all different, and they are identified on the basis of the biological sex, that is the phenotypical sex or the appearance. How you identify yourself, that is your brain. In the brain, how you identify yourself, that resides in the brain. So that is identity. And third is the attraction, romantic or sexual. This is the third point. And over and above, we have the expression, say a person who is bigender, actually bigender. So from male to female, transform in the same life, can dress like a male. On the other hand, say for example, a person is a bisexual, attraction to both. So he's a male person, but attraction to both, can dress like a male. So therefore, the dress appearance has got no relationship with the gender identity or the sexual attraction or orientation. There is no actually relationship. The gender expression is entirely different issue. And to me, if I say that the way to know the gender of a person, it is best way is to ask. There is no way that we can actually think about gender of somebody, or we can just by looking the dress. There is no question of making a opinion about the gender of a person by looking the person, by seeing the dress of a person, by seeing the how he or she carries himself or herself. No, the best way to know the gender of a person is to ask. So what you feel about yourself. But as I should say that some of the person are not sure about his or her gender, very rare. But this is a very straightforward question to most of us, that what is your gender? And you can give a direct, clear-cut answer. To most of the people will give clear-cut answer to this question. But some of the people in this world, they cannot give the clear-cut answer. So they remain confused about their own identity. So when they remain confused about their identity, when they come to us, or talk with a psychiatrist or with an endocrinologist, then by talking to them, by exploring the different avenues of the evaluation, then we can come to a conclusion that this person actually fits with the diagnosis of this, say bisexual or transsexual or whatever maybe it is. But even then, some people actually we cannot diagnose. So over a period of time, the diagnosis may change. So because we cannot diagnose at that particular point of view, they are actually clubbed under the heading of questioning group. So questioning is another group where the people actually don't know where they stands among these group of people, and the consulting physician or doctor himself or herself is also confused about how to diagnose this person, how to identify this person among this group. So it is remained as an open question. So they are actually under the heading of questioning. So all these actually come under the heading of queer group. And let me tell you, roughly around say 0.5 to 0.6% of the world population actually suffers from this kind of disorder. So this study has been done in different parts of the world, in advanced countries. It's not done in our country. But Indian government has looked into the transgender population of our country in the last census, 2011. And in 2011, they have calculated we have roughly around 5 lakh population in our country, which I feel, and most of the people, those who are working on this subject, feels that this is grossly underestimated figure. Because if we look into 130 crore population, and if you consider the 0.5%, then it will become 65 lakhs. So even if it is not 65 lakhs, at least 50 lakh people in our country must be suffering from this kind of disorder, which I say under the heading of queer, and common people actually club all these issues under the heading of transgender.
So, sir, as you said, there is a group of queer. So, could we consider them as gender non-conforming group?
Yes, you can. There are many names of this queer group. Somebody say it is a rainbow community as because they are rainy shades. So you can say that this is a gender non-conforming group. You can say this is a very good terminology, a better terminology, I must say, gender non-conforming group. So there are many terminologies. Actually, all the terminologies are used, and often they're used very loosely. As I have told you, that the transgender word is used very loosely. People, everybody who is lesbian, transgender, gay, everybody is basically think that they are transgender. It is not like that. But anyway, even this is basically now we have separated the transgender as a separately. But say 3-4 decades back, transgender, everybody was actually considered under the heading of transgender. But gender non-conforming is a very good terminology, and people are using this terminology. It basically means the same, that is the gender queer group, or you can say the rainbow community. Commonly it is known as rainbow community, you can say like this.
Okay, thank you, sir. My next question is about the gender identity and gender expression. As we know that gender expression is a person's behavior, mannerism, interest, or appearance that are associated with gender of a particular person. So how does gender expression relates to the gender identity?
Now, usually there may not be any relationship, or there may be relationship. Say, for example, being as a man, my expression will be male kind of dress.
Yeah.
And then I will behave like a man. So on the other hand, a lady will dress like a lady and will behave like a lady. Yeah. And the occupation also, you can see that the most of the women, they don't take some areas, some occupation which is dominated by the male. Though nowadays progressively the female ladies are entering into the male dominated occupations, and also the males are also entering into female dominated occupations. So this line or division is gradually blurring, but still there are some areas where, say, for I can give you a very common example, is in the petrol pump. You will not find a girl who is pouring the petrol. A few years back, I think there was the all female petrol pumps was opened first time. So this is the kind of job which is basically people thought in the mind of the people. There is nothing whether a male can take up or not take up. But it is in the mind of the people that the expression, gender expression, if I do this job, the gender expression, it is not a gender expression. So the job becomes gender specific. Now the dress is gender specific. Nowadays again, the ladies are wearing more and more male dresses. So again, this area of gender expression is basically blurring. Okay. Now coming to the mannerism. Yes, there are a lot of mannerism which are actually basically followed or basically seen in the women, and some kind of mannerism we see in the male. But again, there is no any distinct line between the two by which we can actually completely separate the behavior. No, this behavior is basically only for the male, or this behavior only for the female. So if you look into the gender expression by which we express, we express by our dress, we express in our occupation, we express in our manner. So all these areas are progressively blurring because of the advancement of the society. So the gender expression is also actually are also is blurring, but it depends entirely on the person who wishes or his actually inclination, how he or she will express herself as far as the gender is concerned. So a bisexual person or a transgender person, many transgender person, those who they believe that they are women at heart, they wear the male dress because maybe because of the societal pressure, because of the family pressure. So gender expression don't depend only on his or her wish. Sometimes it is a compulsion. Say, for example, a transgender women. So transgender women or a transgender man. Say, for example, I am talking about a transgender man or transgender woman working in an office, and the people where he or she is working, nobody knows about his actual identity, and he's yet to undergo hormonal therapy or gender affirming therapy or surgery, whatever maybe it is. So he have to dress himself or herself as per his as per his sex described in his CV. So in the CV, if it is written male, then he's supposed to dress like a male. Or in the CV, if it is written as a female, because everybody knows him or knows her as a female, so she's supposed to dress like a female. So gender expression not always depends on how the person willing to express himself or herself. It also depends on the compulsion. The compulsion may be occupational compulsion, it may be a societal compulsion, it may be a family compulsion. But this expression is progressively blurring, as because our society or our human civilization is progressively, and this distinction between the male-dominated dress or female-dominated dress or male-dominated occupation and female-dominated occupation is progressively blurring.
So, how does this gender identity or gender expression is differ from gender orientation?
Expression means how I am expressing myself.
Yes, sir.
Orientation means what is my attraction. So orientation means attraction. So attraction may be a sexual attraction, it may be a romantic attraction, whatever maybe it is. So again, the attraction don't depend on the identity. Say, for example, the phenotypical sex or sex assigned at birth is male, and my identity is female. So basically, I am a trans female. And even if I'm a trans female, my sexual attraction may be towards male, maybe towards female, maybe towards both, maybe neither. So therefore, the orientation or the attraction has got no relationship with that of the sex assigned at birth, has got no relationship with that what is my gender identity. So therefore, it is all these three may be in line when we are talking about a normal male or normal female, or we can say cisgender and heterosexual people. So in a medical terminology, we say cisgender, heterosexual. So if there is cisgender heterosexual, then everything is in line. The common language is straight. So people say this is a straight man, straight woman. So straight, when it is straight, then it is quite in line. But those who are not straight, actually they are under the heading of the square group. So those who are not straight, the relationship between the identity, expression, gender assigned at birth, phenotypical sex, and the sexual orientation, means the attraction towards the opposite sex or same sex or both sex or neither, has got no relationship. There may be lot of variation, lot of permutation and combination, and depending on these permutation and combination, we actually define or we actually group them under different heading. So because of the fact there is no relationship, therefore the all possible combination is all possible combination can be seen in a real world setting.
Yes, sir. So as you told that there is a misconception that gender identity and gender expression are linked with sexual attraction. So like if I am a woman, I will be attracted to a man, or a man will always be attracted to a woman. But if anyone attracted to the same gender, we will be considered them as bigender or bisexual. So, is it possible a transgender person to be a bisexual?
Yes, definitely.
Okay.
No doubt about it. So someone who is attracted to the same sex, we call them as gay or lesbian. If the girl is attracted to another girl, it is lesbian. If a man is attracted to another man, we call them gay. Now a person, male or female, whatever maybe it is, can have attraction to both sex, and we call them bisexual. Now, transgender person can have attraction towards the towards another male, towards another female, towards both, neither, can have attraction towards another trans man, can have attraction to another trans women. So all these possibilities are there. I have seen one of my two of my patients actually, they get familiar or develop friendship with each other. One of them was basically transforming from male to female, and another was actually transforming from female to male. So both of them are actually transgender, and one is a transgender man, another is transgender women. So the both of them are transferring from male to female, another from female to male. And during their process of their transition, when they keep on coming in our clinic, they get attracted to each other, and they have a romantic attraction to each other. And I don't know what will happen in future, but at present they are romantically attracted to each other. So the issue is that this attraction is not towards a normal man or normal female. This attraction towards another trans man. So this trans man has got attraction towards another trans woman, and this trans woman has got attraction towards another trans man. So therefore, all permutation combination is possible. There is nothing actually fixed, and it is basically in our mind, in our society, in our understanding that all these issues are basically wrong. But this is because of the fact. If I go back a little, because as Shaikhat has already introduced and talked about the mythological issues in our country, we know from long back that these issues were there in our society. It was quite accepted. There was nothing wrong in it. We had seen these figures, these mythological characters in Ramayana, in Mahabharata, and nobody has raised a question because of the presence of these people in our mythological literature. But when the English people came to India, when they come to know about these issues, they were shocked, and they had criminalized the same-sex behavior.
Okay.
And once they have criminalized the same-sex behavior, it is basically illegal. So the people, you can understand that those who are hijra in our community, and before you start the hijra community was basically invited in many cultural situations. So in our country, it was a ritual to invite them in many cultural programs. So as because they were actually part of the society. Once the English people came, they criminalized the same-sex behavior. So this Hijra group actually got isolated from the society. People thought that this is wrong. But from ancient time, we know that they are the part of society. They are another human being with some different in behavior, different in their identity, different in their attraction. But that is possibility. Everybody will not have same height. Those who are height is quite say 6 feet 8 inches or 9 inches, they're also maybe normal people. If the height, somebody's height is 4 feet, it doesn't mean he's suffering from some disease. So variation in the, as because there is a variation in the skin color, as there is a variation in the height, as there is a variation in your body weight, so there is a variation in your sexual attraction, variation in your gender identity, variation in your gender expression, and they are normal. And that is why in 2018, if you look into World Health Organization, they have said all these groups should not be clubbed, should not be discussed under the heading of disorder of mental disease. It is actually taken out from the heading of the mental disorder. So it means now the world, which actually in our country was actually already aware for the last 5,000 years that these variations are possibility in the normal people, this actually recognized in 2018 only by World Health Organization. No, this is not wrong. Initially it was criminalized. So from the criminalized, it becomes non-criminalized. Then it was discussed under the heading of psychiatric disorder. Then people thought, no, it is not disorder. So we should consider it as a gender incongruence. And in 2018, now they say, no, it should not be discussed under the heading of disorder, neither any in the heading of any psychiatric illness. It is outside. It is basically gender incongruity is basically a way of life. So this is the way of life. There is nothing wrong in it. There is nothing. This is not a criminal activity. This is not illegal. They are the normal human being. Only thing, they are different than others, than us, little bit. Just like somebody is quite taller than us, somebody is quite shorter than us, somebody has different skin color. So they are different group of people. Sometimes there is some issues are there, medical issues are there. Say, for example, some people have got a distress. Because of this identity crisis, they have a distress. And because there is a distress, there is a possibility of development of different psychological condition. Say, for example, depression, anxiety, suicide. So that is why we are here to treat them, to guide them, so that they can be relieved from those distress. Otherwise, they are normal human beings.
Thank you, sir. My next question is, what is the difference between being a transgender and being an intersex? Is it possible to be both transgender and intersex?
So that is another very interesting question. Now, intersex is basically a disorder which actually occurs because of some disease. Now, there must be some problem because the gender develops in the intrauterine life. At least the phenotypical sex develops in the intrauterine life. It starts with the chromosomal sex. Then there is a development of gonads. And then there is a development of external genitalia or phenotypical sex. Then the baby is born. And after his or her birth, over a period of another few years, the psychological sex or identity develops. Some people believe that the identity start developing since the intrauterine life. It is a possibility, but we don't know. So therefore, the sexual identity or the gender of a person actually depends on four important factors. One, what is the chromosomal sex? Two, what is the gonad? Three, what is the phenotypical sex? And fourth, what is your psychological sex or your identity? So these are the four factors on which the gender of a person develops. Now, transgender, we are talking about only the identity. So the last part or the psychological sex. But during the process of development, a person may have defect at the level of chromosomal sex, may have defect at the level of gonadal sex, and may have a defect at the level of phenotypical sex. So when there is a defect at the level of phenotypical sex, so the genitalia is not like complete male and not like complete female. And therefore, when the baby is born, there is an ambiguity in the diagnosis. Ambiguity as way to consider him or consider the baby as he or she. And therefore, we call them as intersex disorder. So intersex disorder is distinctly different from that of the gender identity. So intersex disorder is different from that. They have some definite endocrine issues in the backdrop. Okay. Now this is also to be considered under the heading of queer group. So under the broad heading of queer group, not only we have transgender, we have bisexual, we have transsexual, we have you have said that the bigender, we have asexual. So we also have intersex. That is also under the heading of queer group. But the intersex group should be should be actually dealt differently, because they require a separate kind of hormonal and surgical challenges. So, but some of the subjects who are basically intersex disorder, and when they are born, and when we have evaluated them as per their chromosomal sex, as far as their hormone level, we come to know that what is the gender of this baby. More importantly, in which gender he or the baby will have better performance in the later period of life. That we have to predict beforehand. So when we have predicted that this baby with an ambiguity will have better performance as a male or female, then we assign the sex as male or female. And then the baby is reared as male or female. Okay. Now, issue is not everybody had shown their baby to an endocrinologist or not evaluated. And as because they are not evaluated, and as because they are not seen by an endocrinologist, and therefore these babies are actually brought up the way the family wants.
Yes,
and if all the families has got a tendency to brought up, when there is some kind of confusion, to brought them up as a male child, because that is our societal demand. So brought them up as a male child. Now, once they brought them up as a male child, in the later period of life, they don't feel that they are comfortable with the assigned sex at birth. So then they fulfill the diagnosis of transgenderism. So because they are gender incongruence, they are not gender, as you say, gender in non-conforming people. So they are not conforming because you have decided a gender at birth, because of the fact there is an intersex disorder and there is an ambiguity in the phenotypical sex. So you have decided that we should bring her up as girl or bring him up as a boy. And in the later period of life, he finds that I'm not comfortable with the assigned gender. So quite naturally, he becomes transgender. So we are gender incongruence.
Okay. So we come to a different point that we often heard the word gender dysphoria. What does it mean?
So as because, the people, those who are assigned male sex at birth, and they develop a different identity over a period of time, they feel that they are female, they're trapped in a male body wrongly. So progressively, there is a distress, there is a feeling of distress. Not everybody will have this distress. Some of the people, those who are gender incongruent, they have this distress. Say, for example, I have a trauma, a small trauma. I feel that there is a pain, not much. Some people say, the same amount of trauma will give lot of issues to another person. So the insult may be same, but the reaction may be different. So not all gender incongruent people will have the distress, but gender incongruent people, when have distress because of the incongruity, we call them gender dysphoria. So when there is a gender dysphoria, it means that he is suffering from some mental agony, mental distress because of this gender issue, because he or she feels that he or she is trapped in a wrong body, because his identity is different with that of the sex assigned at birth.
Okay. So, as you said earlier, that most of the parents are not willing to change their mindset, and the child has to accept their decision. So, is there any way to get counsel the person and accept the gender that was they assigned at birth?
It's a very, very challenging issues now. The problem is that the most of the situation, as I've told you, that the children, when I'm dealing with the children, though I don't deal routinely with the children who have this gender incongruence. Now, if we look into these children, that as I've already told you, some of those children actually becomes normal over a period of time. So just that little bit of counseling is required, and we have to make the parents understand that it may pass on its own over a period of time. Now, this is the first issue. Now, as I've told you, not everybody will recover from this problem. So some of the children, those who have these issues in their mind, may remain, may persist, and may become more pronounced over a period of time when they actually enters from the teenage years into the adult life. So quite naturally, they would like to, they would like to change their gender. They will love to embrace the gender or the identity with which he or she is comfortable with. That may not be acceptable to the parents. That is a very, very important challenge in front of us. So many parents come to us, doctor, you give him the hormones so that he can change his mindset, as because his male hormone is less, that is why he wants to become female. It's not like that. So if you look into a person who is basically wants to transform from male to female, and if we actually test the hormonal profile, then their hormones levels are normal. There is nothing wrong in it. Similarly, those who are girls who wants to transform from female to male, their hormone profile is perfectly normal. There is nothing wrong in it. So hormonal, by giving some hormone, we cannot transform, we cannot change the mindset. It is an impossible task. So people have tried many avenues, but it is a complete failure. Then this issues came that if somebody deserves to become embrace the sex of the opposite, then it is better that we should try to help them achieve that goal. And if we try to help them achieve that goal, then the dysphoria, the distress, but we are talking about gender dysphoria, then dysphoria will reduce and the quality of life improves. So there are a lot of studies which showed that if I believe that the simple acceptance of these people by the society, by the family members, relieves a lot of distress from their mind. So 50 to 60% distress will disappear if the family members accept them the way they are. If their society, if their relatives, they accept them, if their peer group, their friends accept them the way they are, then 50 to 70% of the distress will disappear without doing anything. But to make themselves acceptable, many of them take up this tortuous path of transforming them into the opposite sex by doing the hormonal therapy, by going through the surgical procedures. Yes, that is good. Some of the study showed a gender reaffirming therapy, which includes the hormonal therapy and the surgical therapy, relieves a lot of distress, and there is reduction in the suicidal thoughts, and there is a significant improvement in the quality of life. So that has got an immense role as far as this gender dysphoria is concerned. But I believe that the acceptance or if we can change our mindset, the society, if they can accept or embrace them, as far as you have said that the Nalsa judgment, which actually has given the right to everyone to express his or her gender the way he or she likes.
Okay. So my next question is, what does mean by gender transition?
Gender transition means that how someone is getting transformed from one to another. So transition is a long process, and the process actually involves a psychological counseling, then going through the hormonal therapy, and then going through different surgical procedures, which may not finish within a short span of time. Maybe it requires a long time, and there is no end to it basically. So we have to take care of the psychological issues or psychiatric problem which may coexist as a comorbidity among these patients. So as because they coexist, these comorbidities issues should be tackled very nicely, because there is lot of depression and suicidal thoughts and suicidal deaths. So that should be taken care of, and then we have to start the hormonal therapy, which will give them lot of confidence as far as the uh, improvement in the body contour and improvement in their appearance is concerned. And then last part is the surgery. When they undergo the surgical procedures, then there is a lot of physical changes, and therefore they becomes more comfortable with the sex for which they believe, or the sex of their which actually identify themselves. But the surgical part is a long journey. Sometimes they keep on doing one surgery after the other, say for some change in the nose, some change in the chin, some change in the ear, some change in the hair. So it is an endless journey. You can want some change in the voice surgery. So many things the people can do. So it is a long journey, not a short journey. And the person have to stick to the rule of the journey, and then they will get the desired result, and the distress, the gender dysphoria will disappear, or at least decrease to a significant extent.
Okay. So apart from the medical procedures, as you have said, if anyone want to make the legal changes as a part of their transition, so what are the records should a transgender person change when they are in transition?
So first is I believe that they have to change their name. So that nowadays I believe can be done very easily because of the NALSA judgment that is basically in favor of this community, so they can express themselves the way they like, the gender. They can write any of the gender, say male, female, or third gender. Because of the fact some of the people don't believe that they belong to either male or female, they can write the third gender only. But there are some issues as far as the change in the gender in the passport. So if the person already has a passport, it is very difficult to change the gender in the passport. But once you have changed and have done an affidavit as far as the change in gender is concerned, you have to change the gender in your voting card, in your other card, and all other legal documents. But it should start with the name change in the name, and after this the other issues can be taken care of. But I think that it should not be very difficult for a transgender person nowadays, because the fact that the Supreme Court judgment is basically in favor of them.
Okay. So my last question is that what are the obstacles that can make it difficult for trans people to come out until later life?
Yes, that is a tragic situation. I think I have seen 2 or maybe 3 patients, those who came to me above the age of 50 to get themselves transformed. So that is very sad story. So because of the fact that our society was not very liberal, say 40 years back.
Yes.
Nowadays, as because Supreme Court judgment came in 2014, the transgender right group is working for the last 20 years. So there is some kind of awareness is there among the general population, general people. So we have seen some changes in the acceptance to the transgender people also in the community as well. But it was not there 40 years back. when these people have started their journey. So they had faced a lot of social pressure and trouble, and because the fact they have faced the trouble at the level of the family, at the level of the society, they could not open up. And as because they could not open up, they presented at a very late age, above the age of 50. It is very sad. Now, if you look into our data which we have published, we have found that the average age of presentation in our clinic is roughly around 25 years, if I remember correctly, 25, 26 years. And on the other hand, if you look into the Western data, the average age of presentation is roughly around 14 years, 15 years.
Yes, sir.
So basically, people of our country are actually coming to our clinic 1 decade later compared to the Western counterpart. So in general, it is late. So I don't know whether the society will be transformed or societal acceptance will improve very quickly in near future or not, and whether we'll get more and more younger people in our clinic so that we can start the procedure at a very early age, and we can prevent lot of suicidal attempts because of the fact that they are not getting the support. So they cannot open up themselves. They actually commit the suicide. We do not have any data how many transgender people actually committed suicide. Those who have committed and survived, we have seen them. But those who have committed the suicide, we have not seen them. We do not have the data that how many transgender people actually committed suicide in the last 10 years or 20 years period of time. So therefore, those who are late presenters, as I've told you, 2 or 3 patients I can remember just right now, they came above the age of 50. They must have survived the attempted suicide, and they have actually gone through the trouble of societal pressure and family pressure over decades long, and at the fag end of their life, almost in the fag end of their, at least fag end of their sexual life, they have opened up and came to our clinic for the help. So that is a very sad affair, but I hope that the situation will improve in future.
Okay, let's hope for the best, sir. At the end of the program, I would like to conclude that transgender movement is a part of a long tradition of social justice movement of people working together. So let's hope for the best for trans community, living without fear of discrimination and violence, and being supported, and hope these people to live a healthy, safe, and fulfilling his life.